This is group 10. My name is David.
My name is Theory.
And I'm Michael.
Okay. I guess I can do this slide. So as a little background, mental health disorders are becoming increasingly more prevalent, and also increasingly more prevalent is the usage of AI in mental health services. So chatbots and virtual therapists are new technologies that offer a chance at early intervention in mental health care. And AI can also help alleviate the workload of healthcare workers and make faster diagnoses. Um, and the criticism of the usage of AI in healthcare is usually centered around the usage of ethics. LLMs can lack emotional intelligence and ethical accountability, and that also doesn't include like the actual like healthcare knowledge that AI is limited in. And also, other studies have found that AI approved harmful suggestions as well as provided inadequate responses when it came to the healthcare space.
Uh, you want me to do this one?
Yeah, sure.
Okay. Yeah, not much legislative action has been noted in Congress, mostly due to there have been like attempts, but most have not passed at all. They've just kind of floundered. So as a result, most of the legislation has gone to the states. As you can see, 30 states have proposed or passed AI-related health regulations, some notable examples being California, Illinois, Massachusetts, and Rhode Island. California specifically enacted Assembly Bill 3030 and Senate Bill 1120. Respectively, they mandated disclosures when generative AI was used in patient communication, and they also prohibited health plans from using AI to make necessary medical decisions without human clinical input. Illinois has banned fully autonomous AI therapy, while Massachusetts and Rhode Island introduced bills requiring licensure board approval for the AI use in therapy. And while Maryland doesn't have a bill that passed, they do still have Senate Bill 0987, which would require the Maryland Healthcare Commission to maintain a registry of AI healthcare software used in the state. That is currently still in the works and has not really gone anywhere.
Okay, so getting into some of the findings. So I found a study by Afshar et al. So it investigated AI-driven opioid use in using screeners that were evaluated to support hospital providers in identifying patients for consultation. There's an important distinction to make here. They didn't replace the healthcare workers. They merely just acted as a support tool. So that's an important thing to note. And the effectiveness of this screener is also embedded into the health records to the standard care of identifying patients for addiction medicine consultations. And the study period consisted of 2 years, with the first 16 months being a pre-intervention phase before the screener was implemented, and later an 8 month post-intervention phase after the screener was implemented as a support tool. And the results indicated that there was a relative 11.85% increase in consultation rates in the post-intervention phase versus the pre-intervention phase. And also the OED screener was associated with a 47% reduction in the hospitalization rates among patients 30 days after they were initially cleared out of the hospital, and a net cost of $6,801 per rehospitalization, which totaled to around $108,800 with all patients accounted for in the study. And all of that was avoided for the patient, healthcare insurer, and or the hospital. So there's a pretty good return on investment here when it comes to using the OED screeners in the healthcare setting. And for the analysis, so the overall message is that integrating AI into healthcare can be helpful, but it is only when it is optimized under the assumption that it's designed under the actual healthcare providers for the specific institution, and it's only then can it be potentially effective. And again, it's a support tool and it's not a replacer for the healthcare worker. And there's also potential for the AI screen to lower rehospitalization rates. As mentioned before in the study, there was an 11.585% reduction in, there was an 11.85% increase in consultations after the screen was implemented. And it also saves a lot of money and for other procedures that hospitals need, and it also can help navigate miscellaneous tasks that could also be taken care of by the AI screener, other than addiction medicine consultations. However, there are some trade-offs here. So that includes the potential alert fatigue among providers. Alert fatigue is basically just like all the ongoing noise with all of the healthcare machines that are already implemented within the hospital. Like it can be quite exhausting to constantly deal with an additional machine. And there's also a lack of long-term assessment in these tools. The study that I had mentioned was the first study to investigate how this specific type of opioid use disorder screener can be implemented into the hospital, and the study was conducted in 2025, and so it's still a really recent like discovery, and its overall integration into hospital workflows and addiction treatment needs just more general research because it's such a recent like finding. Yeah.
So after the research, we have found some recommendation and challenges. Restrict AI to screening, administrative triggage, and patient retention support. Man-made disclosure of Gen AI use to patient and rigorous algorithmic transparency. Invest in narrow AI screener embedded directly within electronic health records. And some challenges are lack of unifying federal legislation creates compliance confusion for multi-state networks and potential for ultimate decision-making to bypass critical human clinical interaction. Inconsistent state-level regulations slow down the launch of safe digital therapists. So, for conclusion, ultimately, AI should not be viewed as a replacement for ongoing shortage of mental health professional, but rather as an indispensable tools to optimize the professional we have by shifting the regulatory and development focus away from fully autom- autonomous visual therapists and towards highly regulated human-backed diagnostic assistant, and the healthcare industry can safely bring the care gap without compromising patient safety. And that's it.
Thank you for the team.